Ladies and gentlemen, good morning, good afternoon, good evening, wherever you are. Welcome back to PMY 1420. In this case now it is PSA, Systems Anatomy and Physiology. And so quickly we are trying to summarize the sensory system, physiology and anatomy. And today we begin to look at this one covers nerve fiber classification, also general senses, a bit of physiology to discuss, and as well as pain. Although pain, I think you have it in the next video. So quickly, nerve fibers are classified using two systems at the moment. There's a system that classifies them as type A, B, or C, alphabetical, or Roman numeral 1, 2, 3, 4. So general classification scheme indicates that we have type A, type B, type C. In this order, you find that the type A, they are the largest in diameter, and the type B following that, and then the smallest in diameter are the type C. Because of this, the type A are fast conducting because they are large diameter, and type B followed, then the slowest is type C. As well to note is the fact that while type A and B are larger diameter, they are also myelinated, meaning they are insulated, so they are more efficient in transmitting or conducting of impulses. In terms of the Roman numeral classification 1, 2, 3, 4, you find that the type 1, 2, and 3, they are the ones that are classified using the other system. They relate to the type A and B, which are myelinated, and the type 4 in this case are the ones that are slow conducting. They are the smallest, and they are not myelinated. So this figure, this table, actually just helps you to appreciate the characteristics of the different classes of nerve fibers. So you find that type A, as an example, we have those that carry sense information about position in space, that proprioception. And in terms of diameter, you notice it's 12 to 20 micrometers. And so if you compare going down the column, you see that compared to the C fibers, they are actually larger, way larger, because the C fibers are 0.3 to 1.3 micrometers. And because they are larger, you notice again the type A fibers, their conduction velocity is about 0.4 to 1 milliseconds. Okay, so they are very, very fast in terms of conduction. So you find, meters per second actually. So it's 30 to 70 meters per second. And they are able to spike their action potentials within 0.4 to 0.5 milliseconds. Very, very fast. But in terms of conduction, you notice relative to type C, you'll see the type C fibers conduct about 0.7 to 2.3 meters per second. So you can see also crucial are the examples of type C fibers that you find that slow pain is transmitted by type C fibers. Okay, so slow pain is transmitted by type C fibers. We are going to see when we classify different types of pain, there is fast and slow depending on which fibers transmit that information. So type A delta fibers transmit fast pain. Okay, so fast pain is as a result of the pain transmitted by or conducted by type A delta fibers. Then slow pain is transmitted by type C fibers. So general senses, continuing, is that some of the principles you need to know, I think I mentioned this in one of the lectures, that general senses, these senses are associated with the skin as the largest organ on the body, then the muscles in terms of their extension, the joints and internal organs. So for sense originating from internal organs is also referred to as enteroreception or visceroreceptive senses, and those that are modulated through the skin structures are called exteroceptive senses produced by exteroceptors. And then the sense associated with changes in muscle and tendons distensions. These the kind of senses are called proprioceptive. So proprioceptive is the sense of the position of the body in space. Continue with the sensory system. If you remember, we've talked about the classification of receptors based on the energy that they transmit, and the general senses mostly are using mechanoreception, where they will be producing helping to sense position in space, that is proprioception, as a result of the function of ligaments, tendons and muscles. Then touch receptors also on the skin or in the skin, they help to sense mechanical activities on the skin, like things crawling on the skin, and we have examples of free nerve endings, Meckel's discs, Meissner's corpuscles, the hair follicles, Pacinian corpuscles, as well as the Ruffini's. Then we also have thermoreceptors and temperature receptors, so to speak. They tend to work between 30 to 45 degrees Celsius, and also cold receptors detecting changes in temperature between 20 to 35 degrees Celsius. The pain receptor responds to noxious stimulus. So the skin, this figure indicates the skin having been a very important organ in the body, and it exhibits or expresses a lot of receptors that are able to help us sense a lot of any changes, especially mechanoreceptive activities. So when you look at the skin, it has components where there are places where there is no hair and places where there is hair. So where there is hair, the hair follicles are able to also help in sensing what is crawling on the skin, the breeze on the skin and all these things. But also where there is no hair, there are particular mechanoreceptors under the skin that tend to help. So skin that does not have hair is called glabrous skin, and the skin that has got hair is called hairy skin or non-glabrous skin. So you remember from your biology that the skin has got layers. It has got the epidermis, the dermis and the hypodermis. So the epidermis is the upper layer, the dermis is the middle layer, and the hypodermis is that fat tissue that tends to be underlying the skin structure as connective tissue. So in the glabrous skin, you find these which are called a few Meckel's discs, if you can see a few Meckel's discs, but we also have we have a lot of if you see, we have a lot of Meissner's corpuscles, these round receptors, Meissner's corpuscles. But on the hairy skins you have, or non-glabrous skin, you have less Meissner's corpuscles. Then also, as you go deeper, as you press the body deeper, it is the deeper receptors that will be able to sense that, and the deeper receptors will be the Pacinian corpuscles, the Ruffini's, as well as the Pacinian corpuscles. So you need to pay attention. The Meissner's corpuscles are more abundant in glabrous skin, while the Meckel's discs will help in the non-glabrous skin. So the table below shows a summary of the different types of mechanoreceptors that help with the skin in terms of reception, their functions, and the type of sense they tend to provide. So finally, an introduction to pain is that pain is a very important sense. It helps us to sense a tissue injury or potential tissue injury. And we have different classifications in terms of pain. But pain, we are going to define it as a sensory or emotional response. That is an unpleasant sensory or emotional response that exists as a result of tissue or potential tissue injury. And so we are going to look at later how pain signals are generated from tissue injury, and then we can look at what are the chemical mediators that help in generating pain action potentials, pain impulses. Quickly, if you remember, we have said in the classification of nerves that type A fibers, the delta subtype, they transmit fast pain, and slow pain is transmitted by type C fibers. Therefore, fast pain and slow pain are defined based on the type of nerve fibers that transmit them. Then visceral pain, this is pain that is originating from internal organs, and usually this is referred pain. Okay, and we'll discuss that further. Otherwise, we end here. Thank you very much. See you in the next lecture.